Dr. Lund, who is a candidate for a tummy tuck?
The most common patient we see in our practice for an abdominoplasty, which is the formal name for a tummy tuck, is a woman who's gone through her childbearing years and has had changes to occur to her abdomen because of having children that are beyond her control. She may be a very hard working out, devout exercise person, has not gained excessive weight, and still has the changes that occur to the abdomen. And that's the most common patient. We also see a lot of patients now who are coming in who've gone through massive weight loss, be it either having a surgical procedure or just doing it through diet and exercise. And that includes men and women for abdominoplasty. But the most common still is the post-childbearing mom.
So if someone chooses not to get a tummy tuck, maybe they want to lose more weight or it's not a good timing, losing weight, will it make it a lot better? Is it worth waiting for? What's your recommendation?
Wow, there's a lot of questions tucked inside that question. Let's start with the issue of if the problem is, let's say after childbearing, can you diet and exercise all that off, which is what sometimes a lot of fitness instructors like to state? The answer is probably not. There's no way to diet and exercise stretch marks out, and if the skin is loose and sagging, then you can't get rid of that by diet and exercise. If the problem is due to stretching of the abdominal muscles and they're malpositioned, and yes, you can tone them by diet and exercise, and boy, we encourage that, but you're not going to make the muscles go back into their original pre-pregnancy position by any form of exercise. You just can't pull them back into place. For the patient who is overweight and comes into our practice and is wondering is it the correct time to do an abdominoplasty, you don't have to be at your ideal weight to undergo an abdominoplasty, but you need to be within a certain range of it. But that range is variable based upon the patient's own physical characteristics. If someone's 5 feet in height versus someone 5 feet 10 in height, obviously there's going to be a difference in how much weight one woman let's say, can carry versus what the other can before they're ready to undergo the surgery.